You ever wake up and feel like a wet blanket draped over your whole life? Saps the joy right out of you. That's what we're talking about today. Depression. Not just a case of the blues, but a real serious condition affecting millions. We're going to break this down, plain and simple. We'll look at the warning signs, figure out what's going on in your brain and body, and most importantly, talk about what you can do about it. This ain't about quick fixes, but about understanding yourself and getting the tools to fight back. We're going to get real, get honest, and get you on the road to feeling like yourself again. So buckle up and let's get started. First off, you got to know what you're dealing with. Depression's got telltale signs: feeling hopeless, empty, like nothing matters. You lose interest in things you used to love. Your energy's gone. Even simple tasks feel impossible. And it ain't just in your head. Depression messes with your sleep, your appetite, how you handle even basic decisions. You might be irritable, snap at loved ones, or withdraw completely. Now, everyone feels down sometimes. That's life. But with depression, these feelings stick around day after day, and they start to control your life. You're not weak. You're not flawed. You're dealing with a real condition. Recognizing that is the first step to getting better. Here's the thing about depression. It ain't always one thing causing it. It's like a perfect storm of factors. Your brain chemistry plays a role, those chemical messengers getting out of whack. Genetics can make some folks more vulnerable too, but it ain't just biology. Life throws curveballs, trauma, loss, chronic stress. These can all trigger depression. And let's not forget the environment you're in: unhealthy relationships, loneliness, financial strain. These things pile on and make it harder to cope. The good news? Once you understand what's fueling your depression, you can start targeting those areas and making changes. Knowledge is power, folks. Let's get down to the nitty-gritty your brain on depression. See, there are key areas involved, like the prefrontal cortex, the amygdala, the hippocampus. They control your emotions, your memories, your ability to think clearly. When depression hits, these areas don't function like they should. It's like the wiring gets crossed, messages get scrambled. This explains why you might struggle to concentrate, why you're overwhelmed by negative thoughts, why even simple pleasures feel out of reach. It ain't your fault, it's your biology. And understanding this can help you approach treatment with compassion and a plan to rewire those neural pathways. Now let's talk solutions. First off, if you're struggling, reach out to a professional. They can assess your situation and create a personalized treatment plan. Medication can be a lifeline for some folks. Antidepressants help rebalance those brain chemicals we talked about. In some cases, therapies like ECT might be considered, but treatment ain't one size fits all. Therapy is crucial, giving you the tools to challenge negative thoughts, manage stress, and develop healthy coping mechanisms. Remember, finding the right treatment takes time. It's a journey. Be patient with yourself and don't give up. Treatment is essential, but what about day-to-day life? You can empower yourself with practical strategies. Start small, set achievable goals, even if it's just getting out of bed and taking a shower. Challenge those negative thoughts. They're like bullies in your mind, and you've got to stand up to them. Replace them with positive affirmations, even if you don't believe them at first. Stay active, even if it's just a walk around the block. Exercise releases endorphins, those feel-good chemicals. And don't underestimate the power of connection. Reach out to loved ones, join a support group, don't isolate yourself. Look, depression can make you feel like you're drowning in darkness, but there's always hope. Remember, you are not alone in this fight. Millions have walked this path and found their way to a brighter place. Seeking help is a sign of strength, not weakness. It takes courage to face your demons and commit to getting better. And with the right treatment, the right coping strategies, and the support of loved ones, you can manage this condition and reclaim your life. If you or someone you know is struggling, please reach out. There is help available and recovery is possible. And for more insights into the complexities of the human mind, subscribe to World